right, this is the lecture for the Lab 4 on the appendicular skeleton. So the appendicular skeleton is the bones that make up our four limbs and also the bones that attach those limbs to the axial skeleton. So the pectoral girdle is the structure, the two bones that attach the arms to the axial skeleton. So we have the clavicle, which connects to the sternum of the axial skeleton, and then the clavicle attaches to the scapula, which then attaches to the arm. So pectoral girdle, clavicle, and scapula. Here is what the clavicle looks like. And here is three different views of the scapula, scapula being a somewhat triangular shaped bone with this ridge along the back portion of it. The ridge on the back portion is called the spine. The spine then leads to the acromion process. So spine, acromion process. Then looking directly into the scapula, we see this little depression that's nice and smooth. That is the glenoid cavity where the head of the humerus fits. And coming off the glenoid cavity is this piece of bone called the coracoid process. So again, the four pieces of the scapula you need to know: the spine, acromion process, coracoid process, and glenoid cavity. Here is the bones of the upper limb: humerus, radius, ulna, carpals, metacarpals, and phalanges. So the humerus, seen here, has a smooth rounded knob called the head. Head fits into the glenoid cavity. We have the greater tubercle, a large rough patch sticking out laterally, and then sticking out anteriorly is a smaller rough patch called the lesser tubercle. So greater tubercle, lesser tubercle. About halfway down the shaft is a rough patch called the deltoid tuberosity. And then if you continue down to the distal end of the humerus, we have the lateral epicondyle, this rough bit of bone sticking out laterally, and the medial epicondyle. And then we have these bumps, nice smooth knobs at the distal end of the humerus, which includes the capitulum, which is lateral, and then the double bump here, which is the trochlea, which is medial. And then a little above the trochlea is this depression called the coronoid fossa. And this is the anterior view of the humerus. If we flip it over to the posterior view, we can see a large depression on the back side called the olecranon fossa. Now it's worth noting that the way to know where the medial side of the humerus is to remember the head of the humerus always faces medially. Head of the humerus facing medially, so this is the medial epicondyle. At the elbow joint, we have the humerus coming together with the ulna and the radius, with the ulna's olecranon process fitting into the olecranon fossa of the humerus. And here's the head of the radius. So, radius is the lateral bone in the forearm. Ulna is the medial bone. The ulna has this little U-shaped smooth surface called the trochlear notch. Trochlear notch fits around the trochlea. Then there's this large piece of bone sticking out superiorly and posteriorly called the olecranon process, actually the point of your elbow. And then there's this other bit of bone sticking up called the coronoid process. So olecranon process, trochlear notch, nice and smooth, and coronoid process. Go down through the distal end of the ulna, and we see this little point of bone sticking out. That is the styloid process. With the radius, we have the head of the radius forming a joint with the capitulum of the humerus and also the ulna. And then at the distal end of the radius is another pointy bit of bone, also called the styloid process. Within the hand, we have the small bones of the wrist. These are the carpals. There are 8 carpals in the wrist. Then there are 5 metacarpals. They're numbered 1, 2, 3, 4, 5. One starts on the same side as the thumb. And then we have the phalanges, making up the bones of the fingers. So the thumb has a proximal phalanx 1 and a distal phalanx 1. The index finger, proximal phalanx 2, middle phalanx 2, distal phalanx 2, and so on. So how many phalanges are in one hand? It is 14. 14. You might have thought 5, but I'm not asking how many fingers. I'm asking how many bones that make up the fingers. All right, moving on to the lower portion of the body. This is the pelvic girdle. The pelvic girdle consists of the two hip bones, but we're not going to call them hip bones. No, we're going to call them os coxae. So we have two os coxae, a right and a left. They attach to the sacrum of the axial skeleton at the sacroiliac joints. So again, sacrum, part of the axial skeleton, the os coxae attached to it. The os coxae used to be 3 bones, but they fused over time. The superior bone was called the ilium. The posterior anterior bone was called the pubis, toward the front, and the posterior inferior bone was called the ischium, toward the back. So we still refer to those 3 regions of the os coxae as the ilium, the pubis, and the ischium. Here, pubis in front, and ilium up here, and ischium in the back. So on the ilium, we have the iliac crest, this long ridge running along the top, very rough. Then we have this point sticking out. That's the anterior superior iliac spine. That name just tells you where it is. Anterior toward the front, superior toward the top. Iliac spine, part of the ilium. Then we have this large hole here. That is the obturator foramen. So the obturator foramen, the large hole formed by the os coxae. Then we have this socket, and that socket is called the acetabulum. The head of the femur will fit into the acetabulum. And then this large rough patch on the ischium is the ischial tuberosity. That connects to a lot of muscles, and actually it's the part of the hip, the os coxae, that we actually sit on normally. All right, here again on the lateral sides, the acetabulum. Here is the pubic symphysis, is this cartilaginous joint attaching the 2 pubis portions of the os coxae, and this angle here is the pubic arch. Lower limb has the femur, the patella, the tibia, which is medial, the fibula, which is lateral, tarsals, metatarsals, and phalanges. The femur has this large smooth knob. That large smooth knob is the head. Head of the femur fits into the acetabulum of the os coxae. We have this large rough patch of bone called the greater trochanter sticking out laterally. And then the smaller patch of bone is the lesser trochanter, which sticks out medially and also posteriorly. Go down to the distal end of the femur. We have these 2 smooth rounded knobs. These are the medial condyle and lateral condyle. Remember that the head of the femur is going to point medially, so that's how you know this is the medial condyle, on the same side as the head of the femur. Here's the patella, nice little bone that fits within ligament that helps to form the knee joint. So you can see here's the femur, here's the patella, and then also the tibia. The tibia is the 3rd bone forming the knee joint, femur, patella, and tibia. All right, now we got the tibia and the fibula in the lower leg. The tibia is medial. It has flat, smooth areas at its proximal end, referred to as the lateral condyle and the medial condyle. And then there's this portion of rough bone sticking out anteriorly called the tibial tuberosity. That's where that patellar ligament will attach to, giving us the full connection for the knee. And then way down at the distal end of the tibia, we have this piece of bone sticking down inferiorly downward, and that is the medial malleolus. So tibia, medial bone, has the medial malleolus. The fibula is the lateral bone, and the fibula at its distal end has a bit of bone called the lateral malleolus. So medial malleolus, tibia, lateral malleolus, fibula. These are actually the bumps on either side of your ankle. Then at the foot, we can see the tibia and fibula make contact with the tarsals. There are 7 tarsals making up the ankle. The top or proximal tarsal is called the talus. So the tibia and the fibula form joints with the talus. Distal to the talus is the calcaneus. The calcaneus is the large bone of the ankle that you can also think of as the heel bone. So calcaneus is the heel bone. And then altogether, again, 7 tarsals. So here's another view. Here's the calcaneus. Here is the talus. Here's the rest of the tarsals. So collectively 7 tarsals, including the talus, forming a joint with the tibia and fibula and the calcaneus. Then we have the metatarsals that make up the more of the foot. There are 5 metatarsals, 1, 2, 3, 4, 5. Metatarsal 1 is on the same side as the great toe, metatarsal 2, metatarsal 3. And then we have the phalanges, again 14 phalanges. So this would be proximal phalanx 1 and distal phalanx 1, proximal phalanx 2, middle phalanx 2, distal phalanx 2, proximal phalanx 3, middle phalanx 3, distal phalanx 3, and so on. All right, fibrous joints. Fibrous joints are held together by dense connective tissue, and they don't move. So the sutures in the skull, immobile joints. Cartilaginous joints are connected by pieces of cartilage, either hyaline cartilage or fibrocartilage. They can be a little bit movable, so this includes the pubic symphysis and the intervertebral discs. But most of the joints are synovial joints. These are the joints that allow for a massive amount of movement. They always have a capsule forming around the joint and then a fluid-filled space, the joint cavity filled with synovial fluids. So we have the joint capsule and the joint cavity filled with synovial fluid. And at the ends of the bones, when they come together to form synovial joints, you will find articular cartilage. So articular cartilage at the ends of the joints, joint capsule forming the joint cavity filled with synovial fluid. You can have a ball and socket type of synovial joint, which allows for the largest range of motion, multi-axial motion. That would include the hip joints and the shoulder joints. You can have a hinge joint. Hinge joint only allows for one kind of motion. It's uniaxial, open, close, kind of like a door, or flex and extend. So the elbow is a good example of a hinge joint. The knee, the joints between the phalanges, wrist joint. A pivot joint. A pivot joint is where one bone pivots or moves around a second bone. So one of them is the axis, the other is moving around the axis. It's uniaxial rotational movement. An example of this is the joint between the atlas, the first vertebra, and the axis. Axis is the axis for the atlas. Motions that occur at these synovial joints. We have lateral flexion. Lateral flexion is when you bend over to the side. That's a movement of the vertebral column. At a lot of joints, you have flexion. Flexion is moving so that the angle between the bones in that joint are getting smaller. Extension is the opposite. The angle between the bones of that joint are getting bigger. So flexion, shorter. Angle between the bones, extension, longer angle between the bones. Abduction, adduction is moving out laterally, abduction, or moving back down medially, which would be adduction. Abduction, adduction. Circumduction is when you move a limb so that you form sort of a circle. It's actually a combination of flexion, extension, abduction, adduction, and hyper extension. So that occurs at the shoulders and the hip joints. Like the foot, at the ankle, we have dorsiflexion, moving the foot so the toes go up, and plantar flexion, moving the foot so the toes go down. Plantar flexion, what happens when you walk on your tippy toes. Dorsiflexion, what happens when you walk on the heel of your foot. Medial lateral rotation is rotating at the joint. So this occurs at the shoulder joints, at the hip joints. With the hands and arms, we have supination, pronation. Supination is turning the lower part of your arm so that the palm of the hand faces anteriorly. Pronation, turning the palm so that it's facing posteriorly. So supination, palms facing anteriorly. Pronation, turning it to face posteriorly. And that is it for this lecture.